And my father-in-law said, well, Dan, like I'm hoping that you're going to help me answer that question. They kind of go and they maybe pay a copay and then they kind of like wince in fear, like waiting for a bill to come in the mail. Like they don't know how much that visit is going to cost them. 2014, premiums went up overnight 300%. And that's because actuaries were told, hey, you can't do your job anymore.
Welcome to the podcast, Retirement Done Right, hosted by David Rath and Pat Kalish. We tackle various topics such as retirement, Social Security, taxes, estate planning, wealth planning, and more. If you have further questions or want to learn more, we would love to hear from you. You can reach us at contwealth.com. Please note that the information discussed on this podcast is for educational purposes only and does not constitute professional advice. Listeners should not act upon the information or content without first seeking the advice of a licensed financial professional.
Hello, and welcome back to another episode of Retirement Done Right. We are joined today by a very special guest. Cole Craven is the co-founder and managing partner of Move Health, a company which we'll get into what the description of what they do and how they help in just a second. But let's talk to Cole. Cole, how are you doing? And thanks for joining us today.
I don't know how I got the very special guest, but I'm glad to be here. Good. I'm good. You know, we were just talking about the weather prior to starting recording. We've got beautiful weather in Indiana where I'm at, and it's just been it was an awesome holiday weekend that we enjoyed. I don't know when you all will be listening to this, but it was an awesome holiday weekend that we just enjoyed. A lot of fun with the family. So we got some good weather, but yeah, things are good here. We're moving and shaking.
Awesome. Well, I first came across Cole and his company on a presentation for an advisor group that I'm a part of, and hearing what they do for clients, it made a ton of sense for us to partner up. And so just to give a very brief overview, they help post-employment healthcare needs for people that have just retired and either they are Medicare eligible or they're not Medicare eligible and they need to go out to the marketplace. Cole and his company, they help people find the coverage that fits for them. So if you don't mind, Cole, taking a second and going through the background of Move Health and how it started, and then also just a brief overview for how exactly you approached that dilemma.
Yeah, of course. So, we started Move Health. We're a fairly new company. We launched in September of 2023, but we started it with a mission in mind, which was to improve healthcare literacy, right? And so that sounds like a really buzzwordy thing. Our mission statement is to make health coverage simple and clear. And so, what we saw, and I'll share a personal story here in just a moment. What we saw is that there were really high performing individuals, doctors, lawyers, blue collar folks that have led these like extensive careers, engineers, et cetera, that were all trying to figure out, hey, I'd love to retire before 65, but I don't know what health insurance is going to look like for me on the other side of that. And nor do I know how to even navigate health insurance. I don't know with my current employer plan what it's going to cost for me to go to the doctor. And so that's the problem that we are setting out to solve, which is improving healthcare literacy. We've got a healthcare system, a health insurance system that is more complex than it has ever been, with unique ties to, federal and state government, and what are tax credits, and what's the marketplace, and do I need that, and what are all these different parts and pieces, and at the same point, the lowest rate of healthcare literacy that we've seen in a long time because of the complexity. And so we're on a mission to help solve that problem. And so most often we solve it with the early retiree segment. And so when we started Move Health, we had always worked with financial advisors prior to, my background is in health insurance and Medicare. My two other partners, health insurance and Medicare. We're now a team of 13, here at Move Health, but our backgrounds in health insurance, Medicare specifically, we'd always kind of worked with financial planners, ad hoc. They would say, hey, I've got a client that needs some help. Can you help them out? Say, sure, no worries, not a problem. And it wasn't until my in-laws walked through a scenario that was, that really opened my eyes to the need for advisors, which was there's not a good data source, right, for advisors to be able to key off of for actual healthcare costs for clients in retirement planning. And then there was a real lack of visibility for when a advisor, maybe either sent a client out of their office to get health insurance or Medicare guidance. There was no visibility as to what was happening with that client and what, plan versus actual was and all of those things. And so my in-laws, they were 59 years old. We had just told them, hey, we're going to have your first grandchild. This was 4 years ago. And we said, we're going to have your first grandchild. And we called my mother-in-law's bluff, and she said she was going to quit her job when she found out she was going to have, first grandkid. And she retired. She quit her job. She said, I'm done. And my father-in-law was a fast follow, and he said, "Man, I'm really looking forward to spending time with grandkids, etc." And so he went to his financial advisor. They sat down, he and his wife did, and said, "Hey, what does retirement look like for us?" So mother-in-law and father-in-law are in there, and they say, "Kids are through college, house is paid off, glide path on your money looks good. We're not going to have a tax problem in the future. You guys have done a great job saving, diligent. You can do the giving you want, all the things that are important to them. What are you guys doing for health insurance?" And the advisor kind of posed it to the client, my in-laws that way. And my father-in-law said, "Well, Dan, like I'm hoping that you're going to help me answer that question." And my father-in-law, he's a pretty forward guy. He knew that I was in health insurance. I was going to be able to walk him through that. He said, "Okay, so let me pull up my financial planning software." He pulls it up and tells my in-laws at $110,000 in income that health insurance can be $30,000 a year for them. Blew up the financial plan, all the things, Pat's over there going like, "Oh man, yeah, that's okay."
Yeah.
But all of that to be said, told him in the end an inaccurate number because that's what he had access to. And so that's kind of the start of Move Health, was arming advisors with good data. And then we started to dig into this further, and we're like, holy cow, there's 40 million Americans between 55 and 64. More than 10% of the population fits into that window. And many of them, millions of them, are in my in-laws scenario where they would love to quit their jobs. They have the financial means to do so, but don't know what health insurance looks like, and they don't know how to navigate it effectively. And their advisor, no knock on you guys, their advisor many times they also don't know how to effectively navigate it, nor do they necessarily have the capacity to put time and energy into learning all the nuance of health insurance and Medicare to guide the client effectively. And so that's why we started Move Health. That's the problem that we solve most often, is early retirees or the transition to Medicare, those that are on Medicare. We also help some small business owners out as well and things along those lines. And so that's what we do. We help people all the way from an advisor's office of can I retire, all the way through to I know exactly what plan I need to enroll into, what my costs are going to be when I go to the doctor, et cetera.
All of that stuff that you just described, the complexity, the education, everything that goes into the decision-making process, we work in the industry. And I'll speak for Pat here. I know that sometimes I will get information about our medical coverage, and this is through the employer, and it's confusing. Like, it is crazy confusing even for me as somebody who works in the industry. I can't imagine being somebody who is non-finance related trying to sort through all of this. And this is why we wanted to partner with somebody who is going to be that expert third party who's going to be able to not only help the decision-making process, but also to educate along the way, because education equals empowerment, which equals better decision-making.
Yeah, I think that's if you looked at our website, it's it's creating empowered healthcare consumers, right? Like that's something that's important to us is, there are so many people that do not understand when they go to the doctor or the hospital or a specialist. They kind of go and they maybe pay a copay, and then they kind of like wince in fear, like waiting for a bill to come in the mail. Like they don't know how much that visit is going to cost them. Our goal is for people to be able to go to the doctor and say, "Okay, I've got a pretty good idea of I'm not going to pay anything at the doctor now, but whatever I pay is going to be subject to the deductible or, whatever. Or I have a $25 copay and then I'm done, right? I don't have any more costs associated with that visit." And so being able to empower them exactly allows them to use their coverage, which in turn, if you go really high level and philosophical, helps to create healthier people because they're not afraid to use their health coverage. So
Now, Pat, as the planner here in the conversation, he has a list of questions prepared. I tried to keep it under 100, so just to save time, Pat, let's start going. Get into some of the meat of things that you wanted to make sure that we address for today.
Cool. I'm glad that you brought up like just, literacy around healthcare, because I think, when clients are looking to retire, like I also want that to be an exciting time for them. Right. It's, hey, they're going to stop their day job and they're going to start, a new kind of adventure. And a lot of times, like healthcare planning can be extremely complex and can cause just a lot of stress. We talked a little bit about how it's tough to even understand your current healthcare coverage, but many clients have a grasp of what their current coverage is through their employer. So let's kind of dive into, let's talk about like if you are looking to retire pre 65, what are some of the key options kind of available out there for clients under age 65 before they're kind of eligible for Medicare?
how are we talking in the state of New York or outside the state of New York?
A good question. Let's go outside the state of New
We
York.
can go, yeah, we can go
A little bit.
we'll add some caveats for the state of New York, right? There's some unique rules and regulations that are there. But when we're talking with a client, these are in no particular order. When we're talking with a client about what their health insurance options are when they leave their job,
Mhm.
it's important to note that these are in no order of priority, but these are the options that we would maybe begin to talk about. So the first one that we would maybe talk about would be Cobra, right? This is the Consolidated Omnibus Reconciliation Act. And that was from the 1980s. And effectively what Cobra is not an insurance carrier. Sometimes people are like, "Oh, I'm gonna take Cobra." And they're like, "Where's my Cobra insurance card?" Right?
Right.
That's not what it is. Cobra is the ability to continue your employer benefits. Sometimes an employer will, if it's a part of a severance package, sometimes they'll subsidize that Cobra. Most times they don't. So if you retire and you take Cobra, you're now no longer just paying the employee portion of your premium. You're now paying the employee plus the employer portion. And, spoiler alert for most people that are employed and have coverage through their jobs, the employer is paying the lion's share of that. Most of the time, it's between 70 and 80% of the full premium that they're paying on your behalf. So if you were paying $200, you will likely then on Cobra be paying $1,000 a month, right? And to add insult to injury, Cobra is usually the most expensive. That's why I say that. They farm it out to another organization that administrates it, and they add a 2% administration fee. So you're paying 102% of what what the employer plus employee paid. And so Cobra, it's many times more expensive than the other options, but the benefit of Cobra being you can keep it for up to 18 months. In most places, there's some unique rules and regulations state by state on that, but in most places, you can keep it for 18 months. The other benefit to it is if you're mid-year, you've already maxed a deductible, hit a max amount of pocket, what have you, you can continue that forward. And so in July, August, whatever, we're saying, hey, we want to retire. That's great. Let's look at what we've paid into our plan this year. And if it makes sense for us to keep Cobra and pay the increased premium over the other options potentially, that might make sense because you've already met a deductible. We don't want to reset that mid-year, things along those lines by transitioning to a different plan. So that's Cobra. Usually the most expensive option, but it's one that we would look at with a client. Another option that we would look at is the marketplace, right? So the marketplace may be known as Obamacare, Biden care, Trump care, whatever you want to call it. Whoever's in the office at that point usually is what it's referenced as. This was a part of the Affordable Care Act. So the Affordable Care Act was written into law in 2010. 2010, they wrote it into law, and then 2014, the marketplace was born out of that legislation. The Affordable Care Act of 2010 was the largest piece of healthcare legislation ever passed, and will probably continue to be in perpetuity forever. But it was the largest piece of healthcare legislation ever passed. It said it had impacts all the way from healthcare billing to HIPAA to all these things. But one of the bigger impacts that it had was on health insurance. And the Affordable Care Act marketplace says, hey, you can go buy health insurance outside of a job and you can get coverage for a pre-existing condition. Prior to 2014, in the health insurance business, we would have to tell people, hey, if you want to retire at 58, but you've got an ongoing chronic condition, you don't get to retire at 58, right? Unless your spouse has employer coverage or something along those lines, because no insurance carrier you'd be able to pass underwriting with. And so we think it's super important that people know that even if you're undergoing current cancer treatment, you want to retire, you can, and you can get coverage with a pre-existing condition through the marketplace. So that's important to note. Now, when an insurance carrier is told you can't medically underwrite and you want to participate in the marketplace, guess what? Yeah, Pat's signaling upwards. Premiums get hiked, right? And so on January 1st, 2014, premiums went up overnight 300%. And that's because actuaries were told, hey, you can't do your job anymore. So they just have to assume everyone's in the highest risk pool. So they put everybody up there. The Obama administration that wrote this into law was not dumb. They knew this was going to take place. And so what did they do? They created these things called advanced premium tax credits. And so, Pat, I don't know if we're going to touch on these in a little bit later, but these advanced premium tax credits, basically the way that they work and, really simplifying it is based upon your modified adjusted gross income. You can take advantage of these things called advanced premium tax credits, which is the federal government's way of saying, hey, we knew that when we made health insurance guaranteed issue, that premiums were going to go up. So for you all, as the people that are going to use it, we're going to use these advanced premium tax credits to use federal dollars to actually subsidize the cost back down based upon your financial need. Now, people will hear financial need and subsidy and all these things and assume, well, this is only for low income people. Not the case, right? An example would be in the state of New York, a couple can make upwards of $250,000 and still get an advanced premium tax credit. Now, That advanced premium tax credit is very small, right? But it still exists. So it kind of operates currently like a spectrum. So the higher your income goes, the lower that a tax credit becomes, and the less you receive in subsidy on your health insurance through the marketplace. Vice versa, if you can drive your income down, at least your modified adjusted gross income, we're only looking at an estimate for the current year, you can really take advantage of those advanced premium tax credits. And so, Pat, David, I'm sure you guys have had clients that have come in and said, I want to keep my income low, right? And they're saying, because I want to take advantage of these advanced premium tax credits. And so it's your job as the advisor to kind of weigh the pros and cons of, optimizing for modified adjusted gross income and keeping it low, or do I need to do Roth conversions, what have you. I'm not the expert there. I've stayed in a couple Holiday Inns, but that's the marketplace. And so talked about Cobra, continuation of benefits, marketplace, being you can get coverage of the pre-existing condition. There's a couple others that I'll touch on very briefly. Short-term health insurance, this has kind of been almost gone by the wayside entirely, but this is effectively health insurance that still has some medical underwriting aspects to it. But if you're going to be totally unsubsidized on the marketplace, you're healthy, you're high income, we might look off the marketplace at these and say, hey, here's an option that might fit your needs a little more closely, and it's less expensive than buying a full cost ACA plan or marketplace plan. And the last one that I'll touch on really briefly is healthcare sharing programs. These are things that usually have a faith-based component to them. You pay into them, and you basically, at a very high level, you're pooling member dollars of these healthcare sharing programs, then using those to pay eligible medical expenses of the membership. And so a niche, tool for a subset of clients, but for those that are on it, it can be a really good fit. So those would be kind of the four options we would look at. Obviously, we're going to look at if there's any retiree benefits in the picture, or if there's spousal coverage in the picture, we're going to look at those as well. But typically, we kind of figure out those are a part of the picture before we ever start the other four options. So.
Now, you said a Holiday Inn. I think it actually has to be a Holiday Inn Express for you to qualify for the smarts that come with.
Yeah, that's why I said I've stayed in a couple of Holiday Inns, but not a Holiday Inn Express. If I'd stayed in an Express, I would give the.
You would have known that. Yeah, you would have known all that. So
I mean, that was a great rundown. I think, to like recap, and first off, I experienced the sticker shock with Cobra. Cole, you and I actually had a conversation about this.
Yeah.
So, I just started in Continuum in February, and I looked over the Cobra election form, and it was a shock to say the least. So it's definitely one thing to keep in mind, but I love the idea that you posed of like, you're already met like, your deductibles, your out-of-pocket max. It might make sense to continue that.
Mm-hmm.
And then, for David and I think the one thing we really try and focus in on is income planning. We can't keep your income too low because
Right.
if you're looking at open market, right, like, you're probably then not interested in Medicaid, and it could go that way as well. And then the other aspect is like, we're also trying to balance income so that you can kind of live an enjoyable retirement pre-65. Well, like, you might feel good that you're getting more subsidies. Are you really living the life that, you're trying to live? So those are all things that we're balancing. I think that's why I'm so glad that we're working together, because we hit it from both angles.
Yeah, for sure. I think I see that so often where we have, whether it's, and it's going to sound like a dig on engineers. It's not, but the engineer mindset of like, I'm going to optimize for these subsidies and we're going to eat beans and rice to take care of that. It's like, well, you don't want to do that either. And I think something that's really freeing that, you and David get to do is be like, you don't have to live on beans and rice. Like, we can afford to pay more for our health insurance so you guys can go on that Viking river cruise in Europe or whatever you want to do. Like, yes, we need to keep income planning in mind. And the other piece is you don't want to end up with a tax problem in the future. You over optimize, you take from all your, sources that don't contribute to modified adjusted gross income. And then you get stuck at 72 with these like RMDs that are, like, oh, okay, I've got a big tax problem coming up because I took all these dollars out of different accounts to keep my healthcare costs low. Usually the answer to that equation, from our perspective when we see it, is it's usually a blend, right? We can find ways to keep our income lower, but it shouldn't be the end all be all as far as, our income strategy. So.
Absolutely. I mean, there's so many different strategies too. Taking large distributions at the forefront to cover, a few years of your, call it overall expenses. We use something called like a bucket strategy to protect, call it 5 years of expenses, and, more so like less volatile type investments. So there's so many different strategies so that you're not living on beans and rice, and you're actually enjoying it while maybe collecting some subsidies as well.
Exactly. Right.
Awesome rundown, Cole. So let's flip gears a little bit. We have a lot of clients that are, becoming eligible for Medicare at age 65. So
Sure.
how do the options kind of change? And can you kind of break down the different parts of Medicare for us?
Sure. Yeah. So this is where I always say, like, okay, record scratch, right? Record scratch. We've gone from pre-65. We're now talking about Medicare.
Yep.
And so talking briefly just about Medicare, right? Medicare is a federal program. This is not to be confused with Medicaid. Medicaid is, we're not going to touch on it, is a state-based, lower income, usually typically income, thresholds that are involved with that, state-based for lower income individuals. Medicare, however, is from the 1960s when it's got its start. And Medicare is a federal program that said, hey, you're going to work. We're going to withhold some from your pay every single time that you have a paycheck that rolls through. You're going to pay this Medicare tax. And when you hit 65, or in some people's cases when they become disabled, you're going to qualify for Medicare. And Medicare is, like I said, a federal program. There's a couple different components to Medicare. I'm going to talk about original Medicare, right? So people will hear original Medicare and say, what is that? Original Medicare is parts A and B. So there's 4 parts to Medicare, and I'll talk about the 4 is really kind of 3.5, but I'll talk about first 2, parts A and B. Part A is hospital insurance, right? Part A typically does not carry a premium. This is what you pay for your entire career. You pay for Medicare Part A. Every single paycheck that you make, you're paying for your Medicare Part A in advance. Medicare Part A, hospitalization. It is the bed that you are laying in, it is the Jello you are eating, and it is the nurse that is bringing it to you, right? So that's what Medicare Part A covers, anytime that you spend in the hospital. Medicare Part B, as in boy, is everything else medical, aside from drugs. So everything else medical. So these are doctor visits, labs, surgeries, all of these parts and pieces go into Medicare Part B. Now, people will hear, well, where's a Medicare supplement or a Medicare Advantage plan? Like, isn't that a part of original Medicare? Well, no, but what Medicare Part A and Part B do, Part A is going to cover your hospitalization. Part B is going to cover all those other parts and pieces. But Medicare Part B has a 20% that you uncapped, right? So Medicare Part B is going to cover 80%. You are responsible for 20% of that gap, right? There's a gap there, that 20%, and that's uncapped, right? And so the way that I always preface this is, if you have $1 million stay in the hospital, which is not out of the question nowadays, depending on treatments and length of stay and all those things, you have $1 million stay in the hospital. Medicare Part A and B is going to come in. They're going to pay $800,000, right? Medicare is not going to pay 20%. It's $200,000. So you're on the hook for 200 grand. So that's a gap, right? The other thing that's important to note about Medicare Part B is it carries a premium, right? So the standard Part B premium for Medicare is $185 in 2025. That goes usually up every year. It has gone down. It went down 1 year in the past 5, but it usually goes up every year. But it's $185 a month that you pay. If you're drawing Social Security, it comes directly out of your Social Security check. If you are not, you're billed for it. And so that applies there. There's some other caveats to Medicare and your Part B premium, but that's original Medicare. Part A and Part B, hospitalization, surgeries, and then that gap, that 20% gap that is uncovered. Part D, I'm skipping Part C for a moment. Part D is the only one that really makes sense because it actually stands for what it's used for. Part D for drugs, right? So you are required to carry Medicare Part D as well. And this is coverage for prescription drugs. And so many people will say, hey, I'm turning 65. We see this often. I'm turning 65. I don't take any prescription drugs. Okay, that's awesome. Good for you, first and foremost. Second piece, you still got to have the coverage. Why? Because if you don't take Medicare Part D, you risk a late enrollment penalty on your Part D. Same goes for Part B. If you become Part B eligible, you turn 65 without creditable coverage. You lose your employer coverage post 65, whatever, and you don't take Medicare Part B, you're also subject to a late enrollment penalty potentially there. Those stack up, they never go away. So Part D for drugs, this is prescription drug coverage. It's usually a standalone policy that you purchase. And that policy, has its own drug formulary and actually takes care of the prescription side of things. And so you heard me talk about Medicare Part A, Part B, Part D, and that gap that is there. And so you sometimes will hear Medicare supplement, talked about Medigap plans or Medicare supplements. Those are built to do what? Well, they fill the gap, right? And so Medicare supplements, not to be confused with an Advantage plan. I'll talk about that in a moment. A Medicare supplement comes in and fills that gap, that 20% gap. So Medicare covers 80%, original Medicare does. Your Part D is covering your prescription drugs. Medicare supplement or a Medigap plan, those are synonymous, will come in and take that 20% and cover the rest of it at varying levels depending on what plan type you specifically choose within that. The most popular right now is a Medicare Plan G. And so that Plan G supplement, Plan G Medigap plan is going to limit your out-of-pocket exposure to $257 a year, which is the Part B deductible. So I'm getting super heady here, but there's tons of information about Medicare. I could do a full 2-week thing on it. But so that's Medicare A, B, and D. And we talked about Medigap covering that 20%. Another thing that can be used to meet that gap is a Medicare Advantage plan. And they labeled this as Part C, Medicare Part C. And Medicare Advantage does not work in parallel with a Medicare supplement or Medigap plan. You either have one or the other. And so when you hit Medicare eligibility, you have a choice to make. Medicare Advantage or Medicare supplement, original Medicare or Medicare Advantage. It's really what you're picking between. Original Medicare does not have a network. A Medicare Advantage plan does have a network, right? So a Medicare Advantage plan is going to take parts A, B, and D, and it's going to smush them all together, and it's going to put them in a nice, neat package. And it's going to say, hey, here's a Medicare Advantage plan. It might have some other benefits like dental or vision or a Part B give back where they actually don't draw all of your Part B premium out of your Social Security check, what have you. And it bundles it up really nicely with a private insurance carrier like a Humana or a Cigna or a United or insert whatever carrier name. The benefit of a Medicare Advantage plan, you know exactly what you're getting. You've got some other things that are built into there. A Medicare Advantage plan typically doesn't carry a premium. It's usually $0. The disadvantage of a Medicare Advantage plan sometimes is that you have networks associated. And so many times people want to get to Medicare because the networks go away, right? Original Medicare, open network. Doctor takes Medicare, you can go. Medicare Advantage, you've reintroduced a network again. So you might have an HMO or an EPO or the famed PPO. Everybody wants a PPO network because you can go in or out of network. You've also introduced a little bit more out-of-pocket exposure in most cases than if you were to choose a original Medicare with a supplement. So tons to unpack there specifically, but Medicare is something not to be taken lightly. If you're turning 65, you need to have a conversation with someone you know and trust about this. And because it's an important decision to get right, and I'll put right in quotations. It's an important decision to get right for your unique needs from the jump. So
I have to say this, right? I never see an advertisement or a commercial for Medigap. I always see commercials for Medicare Advantage plans. So, my spidey senses kind of go up a little bit. I know with Medigap, there's an ability to get onto Medigap without medical underwriting, but you may lose that ability at some point. So could you unpack that a little bit about like timeframes of when to sign up for Medigap before that medical underwriting period kicks in?
yeah, good question. And this is going to be somewhat state specific, but I'll keep it at kind of like the national level. I'll just operate in a federal mindset here. For most people, you have something called an initial enrollment period, which is the first 6 months of Medicare eligibility that you have.
Yep.
Within those first 6 months, you can get a Medicare supplement or a Medigap. This could be a Plan G, a Plan N, a Plan A, a Plan K. There's all kinds of different plan names, usually that followed by a letter. But all that to be said, you can get a Plan G supplement in this instance with no medical underwriting. So they're not going to ask you height, weight, prescription drug, medical history, any of those things. If you go outside of that 6-month window, you would then have to undergo that medical underwriting to get coverage, and you could either be rated up or denied, right? Based upon medical history, or you could get passed with no rating, no rate ups or anything along those lines. But in most cases, people that are 65 or older, usually they can't pass that medical underwriting. And so important to, maybe start with a Medicare supplement if feasible, because you can always, this is what I tell everybody, you can always go to a Medicare Advantage plan, always. You can't always go back, right? In most cases, you can't go back to a Medicare supplement, if you leave it or if you don't elect it initially. So 6-month window, right when you hit Medicare, that you can enroll into a Medicare supplement without any medical underwriting. And so that's an important time frame to be talking to someone about that during that. So
yeah, I mean, I think for any of our listeners out there, it's just like, let's have the conversation as you're getting close to this age. Like, let's bring in, Move Health. to really unpack this a little bit, more in more detail to ensure that you have all the options. My dad always said, open up every door, right? You could close a couple, but at least have them all open so that you can make an educated decision.
Yeah.
We're speaking time frames a little bit. So 65, we got that 6 months to sign up for Medicare. But then there's also this thing called like the open enrollment period. So what should like when the open enrollment period comes up, right around October through December,
Yep.
what should clients be reviewing or maybe even just like considering during this time frame if they're already signed up for call it Medicare?
Yeah, so if someone is already on Medicare, maybe they're already on Medicare Advantage, or they're already on a Medicare supplement with a Part D prescription drug plan.
Yep.
The Medicare open enrollment period, or you hear it references OEP or AEP. The Medicare open enrollment period runs from October 15th through December 7th every year, and it is the time of year to review your Medicare coverage. Right. So if you want to make a transition from a Medicare supplement to an Advantage plan, that's the time of year to do it. If you want to make a change to your Medicare Advantage plan, that's the time of year to do it. If you want to make a change to your prescription drug coverage, so if you are on a Medigap with a Part D plan, that's the time of year to do it. And the reason that they do this and they put a time box on it is not dissimilar to how employers have an open enrollment period for their employees, right?
Right.
They don't want people getting sick and then joining the employer plan, right? They don't want someone to pick up a really expensive new medication mid-year and then start paying for Medicare Part D. Same thing would go for, you don't want someone to get into a car accident and then call State Farm and get an auto policy, right? It won't cover it, right? So that's what that open enrollment period is for Medicare specifically, is to review your Part D prescription drug coverage, your Advantage plan coverage, and make changes to it as necessary. And then those changes go effective January 1st of the next year.
Perfect. Very helpful. I'm kind of stealing the show here, David. I apologize. I could talk to Cole all day about this stuff, but you have to jump in with any questions, my man.
With regards to the open enrollment, do you find most people stay the course, or are there changes over time that people make on a regular basis, or is it pretty much just whatever I had last year, I'm keeping it for next year?
Yeah, so that's the important thing is, people have changes throughout the year, whether that's, hey, I was prescribed a new medication this year, or I removed this medication. I'm no longer taking it. It's important to review that. The other thing is, like I said, from the jump, like the only thing that is constant in health insurance and in Medicare specifically is change, right? And there's unique ties to, federal legislation and how things are impacted. And so last year, there was a huge change up on prescription drug costs for the better for the consumer, I will say. But there was a huge change, which was they put a $2,000 cap on prescription drug costs if you have a Medicare Part D prescription drug plan. So similar to the Affordable Care Act, when you tell an insurance carrier, hey, we're going to limit the exposure for a client, and you're going to have to carry more of the burden. Guess what goes up? Premiums on prescription drug plans,
Right.
and formularies get tighter, and drugs within each therapeutic category get smaller, and all these things. And so it's just important to note that, you need to review it every single year. And there are many times where we will tell someone, hey, you're good right where you're at. Not a whole lot's changed. Perfect. No worries. But we don't know that until we talk with them, right? And they might say, not a lot's changed. And then they drop a bomb on us and says, well, I was just prescribed this insert brand name drug here. It's like, well, do you want coverage for that next year? The same thing is, even if you're saying, hey, I'm going to stay on what I had last year, that's fine. But note that drug formularies change on prescription drug plans or health insurance for this matter. But drug plans, Advantage plans, the formulary and actually what drugs they'll cover can change mid-year, and can change during the year or in preparation for the next plan year. And so really, really important to note that you should be reviewing it every year.
100%. And I mean, it's a big part of our conversation too. I think clients really like to unpack and know that like healthcare costs when they work with Continuum are a separate line item. And it's something that we're going to discuss because I think clients are just so concerned with health and wealth. So if we can really have those deep discussions, it's just extremely impactful. And I tend to be realistically conservative. So my hope is that when they work with Move Health, right, actually their costs are a little bit lower. But I just think that's prudent when we're planning out, 30, 40 years into retirement.
Yeah, I think that something that's unique. There was a recent Fidelity study, and you guys may have seen it of what they updated every year. So I think the most recent update came out of what healthcare costs are expected or what you should budget for from 65 on alone. And it's a little bit different between male and female, but I think the average was like $320,000 is the budget of what to carry forward from 65 onward. Now that's an average for people that are going to use massive amounts of medical
Right.
care and others that are going to use less, but it's a sobering number. You start to block that out over the next several years, and you're like, okay, that's maybe $10,000 a year or potentially more depending on life expectancy. So really, really, big numbers to think about. And how are you effectively, considering that? And how are we budgeting for it? What are we putting in place? Do we have adequate coverage to limit our downside? I think that's that. And I think you, Pat, you were onto something as well, which was, insurance is really unique in the sense that it's the only thing that both the issuer and the buyer hope never gets used,
Yeah.
right? You hope it never gets used, right? Somebody says, "Hey, I don't want to use my insurance because that means that I'm sick or had something go on," and the insurance carrier is saying, "Man, I sure hope they don't use their insurance so we don't have to pay out for it," right? So, it's a bummer to have to pay for, but in the same respect, it's totally necessary and it's got to be there. So,
Yeah, you still have to plan for it. I mean, I look at that with even like long-term care costs. If you don't have insurance, like we need to plan for that. Like, hopefully it never happens, but God forbid it does, like you have a little buffer. And the same thing goes for HSAs. I talk with clients. I'm like, if you're healthy, you have this bucket of money, that can cover some healthcare costs, but hopefully you could actually just use it to supplement your income. Right. So
or pay your Part B premium or whatever it might be. There's all kinds of creative ways you can use an HSA even after you can't contribute to it any longer. There's all kinds of ways
absolutely.
you can use
Absolutely.
it. So.
All right, we've went deep. So let's kind of round it out a little bit. Let's talk a little bit about like maybe success stories. So I mean, Cole, you have really leaned in with a lot of our clients as Liz on your team has done as well. Can you share an example of maybe like just a client success story that you've worked with where just like a proactive healthcare strategy has really helped them kind of lead a better retirement?
Yeah, I mean, it's a cool part of what we do because we get the really fun part of sometimes putting the last puzzle piece in place, right? Whether it's the Continuum team or one of our other advisor partners that we work with, they've done a lot of the legwork to get us to the point that where we get to plug in like this last little piece, and it's like the one piece that's kind of hinging, they're waiting to get in place. And we get to talk to people before they're, just making a change, right? So we get to talk to people that say, "Hey, I'm retiring in July." You're like, "Awesome. Let's get your coverage in place, start July 1, right?" And they're like on the precipice of retirement, and we're like talking to them about like what hobbies they're gonna get into. And it's like, "Oh man, I'm gonna head upstate. I'm gonna do more fishing. I'm gonna do whatever." And it's like, I can't wait for that. So we get the fun part of it. But I think one that recently stuck out to me, is just a success story that we see, and we see this in different flavors all the time. But one that we saw most recently was a couple that said, "Hey, we're gonna retire at 63 and a half." Right.
Mhm.
And, advisor says, "Okay, that's fine. You had talked about wanting to retire earlier potentially, but, what's getting you to 63 and a half? You guys are 61 right now. Why aren't you retiring? You talked about you don't like the changes that are happening at work, like, you're miserable, whatever, like, you can financially retire, right? By all means, this couple was ready to." And, the client said, "Well, hey, I'm 61 right now. At 63 and a half, I can take Cobra for 18 months, and then I can take that to Medicare." Right? It's like, "Okay, that's fine. Hey, we just started working with Move Health. Let me send you that direction and you can talk with them." Right? And so we started talking between the advisor and the client, and, income could be, manipulated a little bit. Manipulated sounds negative, but income could be,
Yeah.
massaged or whatever, modified adjusted gross income, take advantage of some of these tax credits that are on the marketplace, get coverage for the prescription drugs they need to take, all these things. It was the wife's biggest concern before feeling confident pulling the trigger on retirement. And we had a conversation with them. The advisor comes back to us a couple weeks later and says, "Hey, we need to get some coverage in place for these people. They're retiring 2 years earlier than they thought they were going to." And so it's not every day that we get to give 2 years of retirement to someone,
Right.
but it is what keeps us absolutely fired up about what we do, in the fact that healthcare planning, health insurance, Medicare, what have you, many times is the last thing that is holding someone at a job, right? How many times have you all come across the client that says, "Hey, I'm 66, but my spouse is younger and they're 63. I'm going to work 2 more years until they hit 65. You don't need to do that, right? So my mantra is always don't let health insurance be the reason you don't retire. There's a lot of good reasons to not retire. Health insurance should not be it. There's too many ways to work around it and figure it out. But we get to see those success stories all the time. That person got 2 years of go years. I don't know how you guys brand it, but I've heard them as like, go years where they're on the younger end of the retirement spectrum. They can travel, et cetera. And this couple is an example. They were members of the which sounds like something I need to be a part of. They were members of the Roller Coasters of America Club. And so they're traveling the country riding roller coasters now. Like that's what they do in retirement. And so we get to do all kinds of fun stuff. So there's all kinds of stories. I mean, I could go on and on about that, but there's a recent one for you.
No, I know. I love it. And I appreciate it. I think that's like the fun part for us as well is, when clients are hesitant, like there's some that really know that they can retire early,
Yeah.
but there's some that are hesitant and they might, hate their job, and they need a change. And, like, hey, in your mom's example, right? Like there's maybe, a grandchild that came into the picture. And if we can kind of provide them with that flexibility, like it makes us feel so excited for what we do. And having someone like Move Health where we can actually check off that huge box and they can have a robust conversation with you so that we know that the plan is accurate and it's in place and they're ready to go is just a great rewarding experience. So we really just appreciate all the help that you've given to us and our clients.
Yeah, of course. And it's an honor for us to be able to do it. We don't take that job lightly. And I think the other thing is we're not just getting on a call with Continuum clients or whoever and just saying like, hey, here's a plan.
Yeah.
That's not what we're doing, right? Like the goal is it would be a total miss if we did that. There's no one size fits all in health insurance or Medicare. And so like from our perspective, we usually tell people like, hey, we're gonna ask you a lot of questions. Just be ready for it, right? And have these things prepared for a conversation because we're gonna ask a lot of questions. We're gonna go deep with you. We're gonna make certain that you have a really firm understanding of when I go to the doctor, what are my costs going to be? When I need to use the coverage. If I'm hospitalized, what's that going to look like? On this prescription medication that I take, here's what the costs are. All of those things are such an important piece, especially as someone, if we think about retirement specifically, you guys know it way better than I do, is that mental shift that takes place from accumulation to distribution.
Yep.
And when you do that, it can be really, really easy. And I will likely do this. I'll be guilty of it. Of just like grabbing onto every last little thing I can control and trying to control it and white knuckling it. When in reality, it's like, hey, we've planned for this. And that's the fun you guys get to have is like the freedom of saying, hey, we've planned for this. You guys are good. Right. And so what a cool job you guys get to have. And it's a fun part for us to be able to step in and do a small portion of it.
Awesome.
Well,
Thanks.
Cole, this is a invaluable resource that you provide for not only our clients, but clients across the country for advisors that you've partnered with. So we really appreciate you hopping on today to discuss more about the landscape that's out there. It is just this conversation today was chock full of information, probably raised a few more questions for people. And that's where you'll step in, your team will step in to help answer those questions for people because it is very confusing and we want to eliminate that confusion, that anxiety as much as possible. Before I let you go, the father of two young boys, have to ask you, what is in the rotation for TV shows right now in your house?
Can't wait
Oh
to hear this.
man, what a loaded question. I can tell you the answer I want to give you, which is like some like really cool hot new like show that's on Netflix or just released or something. I will tell you the reality, which is Daniel Tiger, Blippi, and what's the other one that's real popular right now? A spinoff of Paw Patrol, Rubble and Crew. My son's really into construction, and so we're all over it. I was like, man, we're not gonna be that family that's like, Blippi and Rubble and whatever all those
You
things.
can't fight it. You can't fight it. And as a father of two boys myself, who are a little bit older than yours, you become a connoisseur for kids stuff. You just,
Mhm.
I like this kid's movie. I like this kid's show. Like, let's put that on. I kind of want to watch that.
Yeah.
I will give a hint. The best kids movie, Disney movie that you can possibly put on is Wall-E. Great movie overall. There's
Yep.
no songs. There's not a lot of dialogue. So kids just sit and watch, and my kids both enjoyed it. So I love Wall-E. It's like one of my favorite movies. So put that movie on, enjoy your quiet without getting any sort of song stuck in your head.
I love it. We recently have gotten our 3-year-old clued in on Toy Story. And that was like one, when I was growing up, that was a movie we really liked. And seeing my son, it's a cool, kind of personalization here, but seeing my son like play with like the Woody and Buzz that I had as a kid while watching it, it was like, man, like I had tears in my eyes when I first saw it. I was like, holy moly. So yeah, I mean, there's some fun Pixar stuff and things that we've watched, but yeah, we're not huge TV people, but when it's on, it's kids stuff.
Yeah. Well, again, thanks for jumping on. This was great. And we really appreciate all the work that you do for our clients. And I'm sure you'll have a few more coming your way after hearing this conversation. So thanks again.
Of course. Thanks for having me, Pat. Thanks for having me, David. Appreciate you guys and love working alongside of you. We'll talk to y'all soon.
All right. Take care.
Thanks, Cole.